Hey guys, it's Victor here, and welcome to my 2-week post-op surgery update. So, I had my 2-week post-op appointment yesterday. Today is officially 14 days post-surgery. In general, I feel like almost totally back to normal, so that's really awesome, and I'm kind of surprised that I bounced back so quickly, I guess. At my appointment yesterday, the doctor basically said I should be back to full range of motion. I'm still not supposed to be lifting anything greater than 5 or 10 pounds, and definitely not above my head or anything. But in general, I should have full range of motion, which is how I'm now wearing a non-button-down shirt, as you may have noticed. The doctor also took me out of the compression vest, which it seems like it's very early compared to a lot of other people that I've seen online. It seems like they're in the vest for a solid 4 weeks, and that they're not really at full range of motion with their arms until also between 4 and 8 weeks from what I've heard. But my doctor said, no more compression vest, just wear a compression shirt. So this is, you can even see the nipple pads underneath the shirt because it is a tighter shirt. Yeah, I am out of the vest. It feels great. I'm a little bit worried that it's so much earlier than everyone else that I've seen. But at this point I am going with my surgeon and just trusting what he's saying, and that, he knows what he's talking about. So I picked up these compression shirts off of Amazon for pretty cheap, and it's the best top surgery investment I think I could have made, because I've been checking myself out in the mirror every single day, and I don't know, even from the side, it just looks really, really good. Now, my incisions are still very, very dark, and I learned at my appointment yesterday that the reason they are very dark is because it's a combination of the surgical marker that the surgeon used, as I suspected, which was this dark purple color. He said it mixed in there was probably also some dried blood and some other gunk, as he said, so that stuff will like wash out as the wound heals and as I am like showering more and as the surgical glue is coming off. There was that like plaquey like part that I was really worried about, like right on top of one of the incisions. It turns out that was just surgical glue and it wasn't my skin doing some like really weird thing, so that was comforting. Additionally, my nipples are now not totally black. So at my appointment yesterday, the surgeon actually came in and he like rubbed off all of the black stuff, and it kind of hurt, not gonna lie. Both nipples bled a little bit. They said bleeding is good because that means that there is blood flow in the nipples, which means that the grafts have taken. So they said at this point, there's very, very, very little risk for losing a nipple. They cleared me to start touching the nipples so I can like gently massage soap on them in the shower and that kind of thing. But for the time being, I'm still covering them up with the little gauze pads. They said that I can stop covering them with the gauze pads whenever I feel comfortable enough to do so. But for now, I definitely still want to be more protective of them rather than less. They also switched me off of bacitracin for the nipples and onto Vaseline. So it's really, really low maintenance at this point. The only other noteworthy medical related update is that I had some pain in my right armpit, and in the past day or two, I've now had pain in my left armpit. It turns out, as I suspected, it was lymph node swelling. Doctor confirmed that with the right armpit, and it's kind of the same thing going on the left side as well. He said that that's possibly related to just having been, surgically cut open and all of that stuff. And that's just my body reacting to that. It's also possible that I'm like fighting some kind of infection. I mean, there is, a virus going around out there at the moment. And so it's possible that it's that. I'm hoping it's not that. And that's just surgery related. But he did say they were swollen lymph nodes. And at this point, having only been less than a week, it's not a cause for concern, but that if it continues to be painful and if they continue to be swollen for 2 to 4 weeks or like multiple weeks, that at that point we would want to consider what else might be going on and if it's my body saying something's actually really wrong. But for right now, it's probably going to go away in a couple days and it's not a big deal. Oh, and the last medical thing is that my doctor cleared me to start drinking alcohol. I've been trying to stay pretty active and I've been going out for longer walks every day, so walks that are more than a mile. The past several days I have walked a couple miles there and back to an art museum and been able to just browse the pieces. They have it's a really big museum and they have a lot of different collections, and it's pretty not crowded, surprisingly. I pass very few people. So which is great for, you know, virus conditions. And so, yeah, that's been super duper fun and great for my mind as well as great for my body to be able to like have a destination to go somewhere so that I feel like my walking is justified and that getting all sweaty and gross being outside in the hot August sun is justified. And then I feel good when I come back and I shower, and that's why my hair's a little bit wet. I just finished showering after going to the museum. I also went to the botanical garden and have been like walking to the grocery store and that kind of thing, just to make sure that I'm, you know, walking more rather than less, promote blood flow, promote healing, all that good stuff. I've so far continued to take my vitamin C and zinc supplements, but not every day. It's been kind of sporadic, mostly because I've forgotten, but everything seems to be going okay healing-wise, so I'm not too worried about it. So at the end of 2 weeks here, we are back to basically normal life. Normal diet, although I am still trying to continue eating healthy, low sodium, high protein, like rich in minerals and vitamins and that sort of thing, just to kind of promote healing. Back to almost normal exercise. The doctor said that this week I can do light cardio, and starting at 3 weeks post-op, I will be doing full cardio. No weight training yet. They said that will come after at least a month. But starting at week 3, I'm back at full cardio, so I will be back running 5Ks and cycling and that sort of stuff. I'm back to normal range of motion, although not weight bearing, but I should theoretically be lifting my arms like up to shoulder level and even potentially above shoulder level. And then back to basically normal activities, in terms of like, you know, going out for walks and like walking to places instead of like kind of hobbling places, or like hobbling to the car and then getting in the car and going places. Alright, that's all I've got for my 2-week update. Please consider liking and subscribing for more trans-related content. Thanks for watching. Until next time.